for watching us right here on In Focus. He was a father, he was a husband, and a veteran who served our country for 27 years. Lieutenant Colonel Jimmy Bates passed away earlier this year, and now his family says they're struggling to get the benefits that they qualify for from the Department of Veterans Affairs.
We first introduced you to the Bates family in August. The family says their loved one struggled with care at the VA. Now, months later, they're still waiting for answers. It's a struggle, they say, that has shifted from the VA Maryland healthcare system to an unbearable weight within the benefits office. Heather Bates' father, Lieutenant Colonel Jimmy Bates, died soon after being sent home from the VA hospital. Heartbreak, a struggle in itself.
When someone dies, and especially somebody that served 27 years in the service, you think that, they would contact, their loved ones, especially their spouse, and tell them, we're sorry about your loss.
But the VA Maryland healthcare system stands behind their staff and in a statement says they have reached out to the family, and both a lead primary care physician as well as a patient advocate have spoken to a family member expressing condolences, discussing the veterans' treatment plan, and answering any questions and concerns. But now, for the family, the focus has shifted a bit from the care received at the VA hospital to the benefits side of things and the average 7-month wait time to get them.
We're trying to go through the proper channels and wait it out.
More than 7 months, a wait that for this family feels like an eternity.
It shouldn't be that way. It's really hard.
It's just the latest average wait for a claim within the benefits office here in Baltimore to go through.
It was pretty much the same answer. It's going to take about 6 months to a year for the benefits to kick in.
Bates says her mother qualifies for survivor benefits, the benefits her father was getting from his service in Vietnam, and Social Security. Those benefits would cover all expenses, rent, food, and travel.
Right now, she's surviving on savings. Right now. And that's going to run out.
In Focus, investigators reached out to the VA Regional Benefits Office. So far, they haven't agreed to an interview or sent a statement. Instead, they asked for Bates's claim number so they can look into how far along the family's claim is in the process and who would be the best point of contact for them to work with. They sent us the contact information for a public affairs officer in the Philadelphia regional office. They say the Philadelphia office is most likely processing the survivor benefits.
It's just been hard, really hard.
We gave the family all contact information for both the Baltimore and Philadelphia offices in hopes of finding out where the process stands.
I'm still angry, but I'm more focused on getting answers.
In Focus, investigators reached out to the Philadelphia regional office. They sent back a Patient Privacy Act form, which needs to be filled out in order to check on the family's claim. The Bates family is in the process of filling out that form. The family tells me they originally requested Bates's medical records to see exactly what happened on his last hospital visit. They tell me they've been waiting since his July death, but the VA Maryland healthcare system says they never requested a copy of the medical records, and anyone requesting records needs to complete and sign a release of information form. The family says they did, in fact, fill out these same forms in July, but plan to call the number we provided them with to get everything sorted out.